Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. This week brought to you by Elevate Oral Care.
Hello everyone, I'm Stephanie Eddy with Elevate Oral Care for the June 2021 TIPisode. Last summer, Elevate Oral Care was featured on a few TIPisodes that discuss motivational interviewing and patient-centered communication. Motivational interviewing, patient-centered communication, is a hot topic throughout healthcare right now. Patient-centered communication is a simple conversational technique that will help to guide a conversation according to a patient's values and expectations to elicit a change of behavior. It uses shared decision-making, where the patient and the oral care team work towards one goal of improving the patient's oral and overall health. This enables the patient to have a voice, understand their options, their risks and benefits, their alternatives, and gives them power. This type of care respects the patient's expectations without disregarding clinical evidence. While this form of communication is especially important to implement a true behavior change in patients, offices lack the tools and knowledge to make such changes in their practice. At Elevate Oral Care, we pride ourselves in not only delivering unique dental products that are a step ahead of conventional products, but also providing the necessary education and support that dental offices require. Along with that support and education, we work hard with industry experts to create tools to help simplify the day-to-day tasks that clinicians face. We collaborated with Dr. Matthew Allen, motivational interviewing expert and CEO, co-founder of Different Kind Incorporated, to create tools to assist with motivational interviewing. Together, we created a Caries risk assessment form that not only simplified a Caries risk assessment, but also included some open-ended questions to better work together with the patient to incorporate motivational interviewing to help set up each patient for their best chance of having a positive behavior change outcome. According to a 6-year retrospective study published in the CDA in October 2011, 84.5% of patients are classified as having an increased risk for decay. This study further states that, quote, all of these caries risk patients should have received preventive care treatment interventions, which would have provided increased protective factors and altered their caries balance more favorably. Can you imagine the difference we could make in our at-risk patients of all ages if we properly identified their risk level and utilized patient-centered communication to work together to come up with an in-office and at-home preventive treatment plan the patient is comfortable and confident with implementing? So I want to ask you, are you taking the time to identify patients in your practice that may have an increased risk for developing decay? More importantly, once you've identified which patients are at risk, are you having a conversation with that patient to explain to them their risk level and to offer in-office and at-home treatment options to get that patient as healthy as possible? According to a recent article in the CDA Journal from January 2021, quote, CRA or Caries Risk Assessment can assist oral health professionals in helping patients avoid severe stages of dental caries as well as prevent future dental caries. For optimal results, a caries risk assessment should be accompanied by appropriate intervention, prevention, treatment, and patient education. The results of the CDA Journal revealed that, quote, despite positive attitudes and high confidence in using caries risk assessment, 43.2% reported rarely or never using caries risk assessment. Time was reported as a significant barrier to use, followed by knowledge of how to implement the tool. Knowing that 52% of clinicians reported not conducting a caries risk assessment due to time, Elevate's caries risk assessment form is simplified to help overcome the barrier. The typical caries risk assessment contains an average of 14 close-ended questions. Elevate's form has 5 simple close-ended questions to use in order to identify an increased risk for decay, and additionally has 4 open-ended questions, utilizing a more patient-centered approach to have a better understanding of your patient's goals and habits. Elevate's form allows for the clinician to be better armed with the necessary information to work together with the patient to develop a treatment plan with high case acceptance and compliance. At Elevate Oral Care, we've got you covered. We have a full line of in-office and at-home preventive products designed specifically for your at-risk patients of all ages. And more than that, we've simplified tools to help you easily integrate a Caries risk assessment, and we provide the education for you and your team to help improve communication with your patients for better case acceptance. These free tools can be used in-office or through a teledentistry platform. Schedule a free AGD PACE certified continuing education lunch and learn, staff meeting, or live webinar with your Elevate Oral Care Preventive Care consultant today to learn more about our free tools and how to implement them, as well as our innovative line of preventive care products. Visit www.elevateoralcare.com or call 877-866-9113 to request a staff meeting today and find out more.
Thanks for listening to another TIPisode. And thank you to Elevate Oral Care for sponsoring this week's episode. You can find out more about their great products at elevateoralcare.com. And don't forget to hit the subscribe button in your podcast app. Follow us on Facebook or Instagram, and head over to our website, ataleoftwohygienists.com, to sign up for our newsletter. We always appreciate ratings and reviews. And thanks for listening to your unofficial dental hygiene podcast.